we need to talk very seriously, all of us, about the cost of the safety, because the cost isn't safe, right? So we're taking one risk to prevent another. And so it's always a matter of balance of risk. There isn't a pathway to safety through all of this. And so I'm also concerned, like, to make the vaccines mandatory is going to do, and to punish people who refuse them for whatever reason they refuse them, it seems to me that it's a sign of the failure of the vaccination arguments, essentially. So if you haven't made the arguments credible enough to convince the percentage of people that you think should be vaccinated to be vaccinated, then that's a failure of your argument. And then to move to use political force and police force, for that matter, obviously, to insist is only going to increase the distrust that's driving the resistance to the vaccines to begin with. You know, you spoke at the beginning of people's decrease in trust in the medical establishment, so to speak, and also in the political establishment. When they have to, when those systems resort to force to impose their view of what the proper pathway is to safety, that's going to produce a long-term, permanent, serious damage in the credibility of those institutions. And that's going to have a tremendous cost in terms of health as well. So I don't understand. So, and then I've been trying to think through a solution. So in Canada, we have a fairly high percentage of people that have been dually vaccinated. And it seems to me that the appropriate approach is something like for the governments to say very honestly and carefully to people, we've made the vaccines as available as possible to all of you. There's nothing standing in your way but your own choice that's preventing you from being vaccinated. As a consequence, we're going to reopen our country radically on this date. And then your destiny is in your hands, as it should be. And it seems to me that hoping that the vaccination rates are going to exceed 90%, I think that's a high-end estimate, and I might be wrong about that, is a pipe dream. Too much force is going to have to be applied to people to get them to do that, and many people will just not do it. And then what are we going to do with those people? Are they now pariahs? Are they now criminals? And if they are, because it's going to be a big chunk of the population, how exactly are we going to deal with that? So I see that we're in danger of exchanging the possibility of pandemic damage with the certainty of the danger of authoritarian imposition. So, so that's, I'd like you to respond to that, I guess, and tell me what you, that's what I think the policy should be, is that we have the vaccines, that they may not be as accessible in Australia yet as they are in Canada. We have plenty of vaccines in Canada. It's like, I think the government and the health authorities would be much more credible if they said, look, we really think these vaccines work, but we're not in the business of forcing them on you. You can make that choice. We've done what we could to provide them for you, and now it's in your hands. And is that a stupid idea? Like, because I don't know, but I'm not impressed by this creeping authoritarianism in the name of public safety. I just can't see that that's going to go well. I think it's going to cause more damage than it's going to do good. I don't know what these new regulations in the U.S. are going, what kind of response they're going to produce, but I can't imagine that it's going to do anything but exacerbate the tension between the left and the right that already exists in that country, and that is severe enough to be somewhat destabilizing already. We're going to introduce vaccine passports in my home province in Ontario, despite the fact that there's a conservative government in power at the moment. And there won't be as much of a reaction to that in Canada as there will be in the US to similar measures. But it just seems to me that that default to force is an admission that the argumentation has been stunningly inadequate. And instead of addressing the problem of the inadequate argumentation, the shortcut is, well, those people are too stupid to know what's good for them. And so and for the sake of everyone else's well-being, it's justifiable to force them. That might even be okay if it was going to produce the results that are intended. But I don't think it's going to. I think it's going to produce a kickback that will make things worse on the vaccination front rather than better. And we might ask ourselves, too, is like, you know, part of the reason the U.S. has given up on the war on drugs is because it was unenforceable. You had to push the state so far in a police state direction to stop people from using substances like marijuana that everyone eventually just said, look, man, it's just the cure is worse than the disease. And well, that's the danger that we're facing, I would say. And it's always the case with policy. I understand that the cure can be worse than the disease, but reasonable people can certainly make that argument that there's tremendous danger in making an active, invasive medical procedure mandatory. There's terrible danger from a precedent perspective. You know, because what if it does turn out, for example, that one of these vaccines has unforeseen long-term consequences, and it's been given to hundreds of millions of people?
And I understand medically that. I understand medically that there is a distinct possibility that that precise thing will happen, and then
it's certainly not zero, the possibility. And so, and the fact that a percentage of the population perhaps exaggerates that possibility because they're more conspiratorial in their thinking, or less trusting, or more skeptical of government, benevolence, and health, and all of that. I don't really care. You can't eradicate the possibility that their objections, guided by their conscience, let's say, are, and this is your point with regards to conscientious objecting. It's like you said that even when we were fighting the Nazis, we weren't so certain that you couldn't say no because you had a different set of beliefs that were truly and validly held. So, and then I am also concerned about the precedent we're setting. And I suppose people who were opposed seatbelt laws and helmet laws and that sort of thing had the same sort of notion, which is, well, once you let the government decide what's good for you, where does it stop?